You got me in frame?
Yeah.
Dr. Rachel Greenberg here, Board Certified Dermatologist at Las Vegas Dermatology. We're going to be numbing up these cysts. They're massive, they're multiple. We're going to do an incision and drainage of them. First thing first, you're going to numb it. We'll come back after they're numb, and then Nick can drain them with the lemon blade. You can see it already coming out the area. You okay?
Yeah.
But the one thing about these things is they shoot their contents out because they have this pore. Still okay?
Yeah.
I don't have to watch this, right? Because we're going to have a video.
No, we have a video of it. Coming underneath.
You should put a camera in so you don't have
That
to.
would be good.
Oh, that hurts, huh?
A little.
Oh.
It's no rodeo.
That means a lot because he has pretty good pain tolerance. So.
Yeah.
But Dad, you got to do this. This is overdue.
And actually, we can film the whole thing because what will happen is as these ones are getting numb, the other ones are already numb, and we can just go into them. You okay?
Yeah.
It's not that you're not going to feel anything, because you will.
Did you get that one down there? That one that's starting?
Yeah, we'll get one more syringe.
Skin is so weird.
Well,
It's weird.
it's just natural. And I guess natural is what you get when you start. And we're just going to try to make it a little bit better than what it was. And where's the other one that you wanted?
Isn't there a black?
Lean forward.
Lean forward, Dad.
This
Where is
thing?
it? No, no, no. Wait, is that
See?
it?
Yeah. That one, I mean, you can already see it coming out.
Ew.
Yeah.
Holy crap.
This thing.
I don't know.
All right.
I guess that was
Oh,
it.
we'll
I'm
get
sorry,
started.
Meridian.
You're in the frame. That's okay.
Is this genetic?
Oh. Yeah, that one just came out.
What is that? Dead skin cells?
It's keratin. Keratin's like a plug from the follicle. And actually what we need is a comedoid extract. So we're going to nick each one. Okay.
Hang in there, Dad. I know.
You alright?
Yeah.
We'll need like a couple band-aids for when we end up doing it, but
Yeah.
basically, these have all been nicked now.
Should have worn a red shirt, Dad.
It's just a little elbow grease to get them out.
Oh, God.
And because these have been in there so long, they're really filled up.
Oh, my
You know.
God. Holy crap.
So there's one.
Dad. Yikes.
It's not the worst I've ever seen.
Seriously?
Yeah. But he does have a bunch. So,
Oh, that was that one that looked like little
see.
larva or some crap.
Oh,
That weird one with the hole. That was really weird.
yeah.
Look at that.
And it just mushes right out. Nice and easy. It's all keratinized tissue.
My husband would be so jealous right
Is there
now.
worms in there?
He'd probably want to do it. There ain't no worms in here no more. No, really. This is just keratin, and it's a sac. The sac produces the keratinized contents, and we're just scraping those contents out. Ultimately, the sac will have to be removed in order to cure the condition, but you have so many of them, we'd have to schedule multiple surgeries
Oh, jeez.
just to remove them. So what I'm doing today is I'm clearing the sac of all its contents
Okay.
in all these different areas. It'll make your life better.
Now, would it help for him to use like a loofah on a long thing and wash his back better? Would that keep him from
It
coming
will
back?
help moving forward in the future. The only way to treat these now is to do what we're doing because
Yeah.
they're so deep in there. There's so many. But yeah, I mean, a time machine would have been nice to do the loofah.
But if you got one of those ones on a stick and did that on his back, that should help, right? Keep that area
Yeah, it'll
clean.
help. We have a treatment here called the hydrofacial. It's a wet microdermabrasion,
Mm-hmm.
and that would really assist.
I can't believe I'm not throwing up. I'm making
I
progress.
appreciate you not doing that, because
Sorry.
then the rest of us would throw up too.
This is incredible, Dad. Holy crap.
Yeah,
This
I
is-
mean, there's a lot of contents in here.
You're like a science experiment. Wow, this is wild. Skin is wild.
You know, but these are really, just imagine, I don't know how many years these were in here, but they were embedded. I mean,
Well,
the
he's
keratin in
86.
here, 86, You know, so the keratin in here, you know, could tell the story of like the Civil War,
Right?
you know, the crossing of the Delaware.
Well, he was in the Korean War.
Really?
So, yeah, he's a tail gunner.
There you go. Yeah, I went to Korea 2 years ago.
Oh.
I wanted to see what was going on at the DMZ. Unfortunately, DMZ was closed down at the time. But it was one of the coldest places I've ever been in my life. Were you there in the winter?
Yep.
Was it cold?
Yep. I was there in the summer and it was hotter than hell and it stunk.
Yeah. Well, that street food in Seoul was unbelievably good. And the people were super nice.
He was in the mess hall, right, Dad? You didn't get
Oh,
to...
well, probably had spam.
In the Air Force.
Yeah. Yeah, but it's like the never-ending story inside this thing. There's so much keratin in here.
Oh my God, Dad.
I don't know if this is Korean War keratin or not, but there's a lot of it.
Do you remember when you started getting these? Was it like 30 years ago, 20 years ago?
No, I don't really. I know they've been very noticeable lately, but I've never noticed them before.
I feel like it's at least 20 years. But
My upper left shoulder started itching.
it's not even on your shoulder.
Well, it seemed like it was puffy back there.
You're just a mess, Dad. If this is genetic, I guess I can.
Well, you know, this is just keratin buildup over time. So the best way to solve a problem is to, one, prevent it.
Yeah.
And two, when you have it, just get it early. Because the longer you let these things go, the more issues you get. Now, one thing you would worry about is could this get secondarily infected? We're going to write you for a wash and a topical antibiotic to put on the area. Lean forward.
Okay. Lean forward, Dad.
This one was already squeezed out.
This one to me was like one of the weirdest ones because it looked like little larvae or something.
Yeah,
Like,
see.
oh, what?
Worms.
No, Dad, it's not funny. It's really gross.
Yeah, there's no worms. There are no worms in here.
Well, there are, but they're dead.
You know,
they're
I have
dead
seen
worms.
I have seen a human botfly before,
That. Oh my
but that
God.
was somebody who came back from the Amazon.
No, I'd throw up for sure if you dug out
Yeah.
some kind of creature. That's it. I'd be
But there is
passed out
no
on the
creature
floor.
here. This is just keratinized tissue, which is the grease that's used to let the hair come out of the hair follicle. You know, you may get more in the future, but these ones, you know, it's possible without getting the sac that they'll fill up again. However, your comfort level will be greatly improved.
Well, and if it took this long to get this bad, I mean, I can't.
Yeah, in
imagine.
another 80 years, we'll do it again.
Yeah.
Yeah, we'll have at it.
So he doesn't need to take an antibiotic or anything.
We're just gonna put it. See, I mean,
Holy
it keeps
crap,
going.
It just keeps. Oh my God, Dad, this is crazy.
You know, so
This is like a science experiment gone wrong.
Sounds like a horror show.
Well, it's kind of gross. I'm not gonna lie.
So what we'll do is we'll get your permission. We'll send you the video. We'll post this and
Absolutely.
make other people aware of the
Well, I
issues
think
of just
it's
letting things go.
Like out of sight, out of mind. You don't see your back. You don't.
Right.
You know.
Yeah, I've seen that
And I
before.
didn't want to like torture him, but I just decided this is gross.
Yeah, enough's
and,
enough at some
I
point.
mean, yeah, and they weren't gonna get any better. You know.
Yeah, so I think we're good here.
Let's take a look here. So, Dad, you got to use. Mom has 2 of them in her bathroom. It's like that long plastic handle, and it has the poof thing at the end.
All right, so that
And you can
was
use that, like, over
cyst
your shoulder
removal.
to clean your back.
I&D used this in my 11 blade. Here's the 11 blade.
So much better, Dad.
Anyway,
Is there a
Rachel
little?
Greenberg, Las Vegas Dermatology.
Sorry, is there a